Hi students, Dr. Carver here to talk with you about test sensitivity and specificity. We've discussed levels of prevention in community and public health nursing, and you understand that screening and testing are tools we often use when implementing secondary levels of prevention. Which tests should we use? And can we rely on the tests that we choose? Understanding more about test sensitivity and specificity is an important consideration when determining screening and testing that we use for interventions. In clinical practice and in public health, we use tests to determine healthy and diseased individuals. Typically, these tests assess a continuous variable like blood pressure, which is measured in millimeters of mercury. Healthy and diseased individuals usually have different distributions of that variable. We choose a threshold above which individuals are classified as diseased and below which they're classified as healthy or non-diseased. Where we choose the threshold is very important. If the threshold is too low, many healthy individuals may be falsely classified as diseased. If it's too high, many diseased individuals may be falsely classified as healthy. If a test is able to classify a large proportion of diseased and non-diseased correctly, it's said to have a high validity. In other words, considered to be a valid test. Test validity has two major components, sensitivity and specificity. These are quality criteria for the test. Here's an example to illustrate. Let's say we have a population of 1,000 and 150 of them have hypertension. This means the prevalence is 15%. We've screened them and 120 of the 150 test positive, meaning our screening caught their hypertension, but 30 who actually have hypertension were missed by our test. On the other hand, 770 people who don't have hypertension, or who we call non-diseased, are correctly classified as negative. 80 are falsely classified as positive, meaning we've now said 80 individuals have hypertension, when in fact they don't. The sensitivity of the test is calculated as the number of diseased individuals who are correctly classified divided by all diseased individuals. So 120 divided by 150 times 100, which equals 80%. In other words, the sensitivity is the proportion of diseased individuals correctly classified, and that's 80% in this case. The specificity is calculated as the number of non-diseased individuals who are correctly classified, divided by all non-diseased individuals. So 770 divided by 850 times 100, which equals 90.6%. The specificity is the proportion of non-diseased correctly classified. Diseased individuals who test positive are called true positives. Non-diseased individuals who test negative are called true negatives. On the other hand, diseased individuals who test negative are called false negatives, while non-diseased who test positive are called false positives. Ideally, we would love for everyone to fall into either the true positive or true negative groups. However, no test is perfect. So we end up with people in the false negative and false positive groups. Now, what does this mean in terms of consequences for landing in a false group? Well, someone who's falsely labeled as positive may be sent for further testing, subjecting them to potential risks of invasive tests, along with associated healthcare costs and anxiety for them and their families. Plus, the label associated with the false test might stick with them for a long time. Think about patients you've cared for who may have been falsely diagnosed with hypertension. That diagnosis may continue to follow them because it's copied from one patient report to the next. On the other hand, someone who's falsely labeled as negative, who has a potentially treatable disease, might be sent home and become sicker or even eventually die because nothing is done to treat the disease. Therefore, when we choose the threshold of a test, we have to weigh the relative importance of problems associated with false positives and false negatives and consider the sensitivity and specificity of the tests we choose to use. I hope this video helps clarify the concepts related to test sensitivity and specificity. As always, if you have questions, don't hesitate to post those in the course or feel free to email me.